I am going to start recording. Yay. So this is our May webinar as part of our support for hospitals that are working on baby-friendly designation, baby-friendly practices. I'm pleased to turn things over to our glorious Sarah Bellotti, who's our OBRC Joan of all trades, keeps us in line, schedules all kinds of things, and is doing a webinar to guide you through all of the trainings that our Oklahoma Breastfeeding Resource Center offers. So I'm going to turn it over to Sarah and switch out here.
I'm pretending that everyone's clapping.
Yeah, it's cute.
Where's, oh, 9.
Yeah, just in that. Oh, because it's down, like raise this up a little bit.
Raise the whole thing up.
Yeah, and then there's your
is.
admit. Yeah.
Oh, okay.
I don't know if it'd be better at the top, wherever you think.
I'll move it up to the top,
You can
just
try it up
since
there
I couldn't see.
Yeah, right, because that thing
person.
drops down then. So.
Okay.
Yeah. Okay.
Okay.
Now you're good.
Now we're set up, ready to go. Apologies for the slight delay. So as Becky said, my name is Sarah Bellotti. I'm the office administrator here at the Oklahoma Breastfeeding Resource Center. And I've officially been working here for 1 year, and I am now totally a breastfeeding enthusiast. And it's a little bit about me. I have no children. I've never breastfed. I did not know anything about it coming in, but now I am quite a champion for it, I like to think. So just a few quick reminders. Please feel free to just chime in and ask any questions if you have any. You might also want to mute yourselves until you're ready to ask any kind of question. So that way there's not any interference throughout the webinar. So, nope.
I'll probably have to just
do I need to
mouse
click
back
it?
again. Now try.
Yeah, there we go. Okay, first and foremost, I do not have any financial interests to disclose, and I told Becky that I hope she wouldn't be offended that I traded a picture of Alan for my babies, Sherlock and Watson. That's Watson on the left, Sherlock on the right, in their bow ties. You've seen this before. This is our team, our lovely OBRC team. So I am the third one there, if you have not seen me. And the only one not present today is Amanda, who is our lactation consultant, who is actually in clinic right now, seeing two patients. Now I gotta click.
Oh, did you skip one?
Did I?
Did you go?
Oh,
yeah, there you go.
Sorry. Thank you. So a few quick announcements. Talking about the team, we've added a new team member to the hotline, Jacqueline Huxford, and she just started about last month, and just in time for us to add texting. Yay. It's actually just being piloted, so we won't be making any major announcements about that yet until we've been able to pilot it and we know that we're ready. My last little announcement is a quick question. Are you submitting your monthly breastfeeding data? And what that, and when I ask that, that means that our hospitals that are part of our Becoming Baby Friendly in Oklahoma program, we ask that they get in that process that Baby Friendly requires, of where you log and submit your breastfeeding data. And so to help you get into that practice, we ask that you practice sending it to us, so that way as you go on and become designated and then eventually redesignated, that you've already got that practice in place. Plus it allows us to kind of have that data and be able to see and keep up. Is that about right?
Yeah, and so yeah, no worries. We have been a bit lax in reminding people, so we'll be getting back in touch with everybody as we approach the end of our fiscal year to kind of revamp that piece. So.
Just quick little notes here of, since every month has quite a few designations for it. We've got Nurses Week, National Women's Health Week, Employee Health and Fitness, and Teen Pregnancy Prevention, all in this lovely month of May. So our agenda for today is short and sweet. We just are going to be covering the 3 training options that OBRC provides to you and to the public. So we'll do a review of our new online training platform, Digital Chalk. Then we'll review our NBME trainings and then our BBB trainings. I know those are acronyms. We will go over them later. So why are we talking about training? Why is it important and still okay to do in a webinar? Well, because it's part of the 10 steps. Step number 2, staff education. So the specific criteria within that is that your nursing staff are, well, by requirement of the Baby Friendly USA, are asked to have 20 hours of training. So that's 15 sessions over topics and competencies that UNICEF and WHO and Baby Friendly have all agreed are paramount, and then 5 hours of supervised clinical experience. Now, in addition to that, but not being covered today, is the healthcare providers requirements, which is just 3 hours of breastfeeding management education that's pertinent to their role. So let's talk about our new online training. The new online training management platform, as I said, is called Digital Chalk. You'll hear us refer to it as DC throughout this webinar, and probably as long as we're using it. We really like acronyms here. We have 2 main links for it: our registration page, our login page. We're going to talk about why you should choose OBRC's online training, our goals, and just the benefits of it. And most importantly, just how to use it. So, if you haven't seen our new website, this is a quick screenshot of the events and trainings page. This page will always house the links that I just mentioned. Now, we're talking about our new platform, Digital Chalk, but I just want to briefly mention we have since 2016 and are in the process of fading out of using the online system called Desire to Learn, or D2L. So you'll see here on this page, there is a cream-colored box, and in this box is the online breastfeeding education for staff links. We do still have who are in the we do still have people who are enrolled in D2L, and we have sent out a mass email, and we'll send out more between now and July 31st, because we would really like to be able to have everyone using our new platform, Digital Chalk, by August. So just let me say that again. If you've got people enrolled in this is going to happen. If you have people enrolled in D2L, they've got 3 months to go ahead and complete that training and get their certificate. If they're unable to complete it, D2L is going away after July 31st, so that their progress and everything will be lost, and we really don't want that. So we're going to keep sending out a lot of reminders. Since I did briefly mention the provider requirement by Baby Friendly USA, I just want to say you'll see also to the left a blue box, and those are 3 links for free free online trainings. You'll see there's 6 lectures, and then they vary from who's providing them and the content itself, but it all would be applicable to the requirements set by Baby Friendly. Okay, so let's pretend that we are ready to get started and enroll into our new Digital Chalk. This, as I said, we have our links, and we will start here where you'll just go to our first link, which is our registration link, and you'll just simply click the register now, the green button, and you'll see here there's a drop down where it says more options. You can also do a multi-seat registration. And so here's where I know some of you will ask me, can I please enroll 20 of my staff members? Absolutely. And so now that Digital Chalk, one of the benefits of it is that it's one-stop shop. So you can register and pay all right here. Now, I know some of you do still need an on-voice, and we will still do that if that's something that your facility requires. So once you click the register button, you'll be moved to this little item here. And I've blanked out the prices for right now, so because we're just focusing here on the how-to. So what you'll do is once you click to register, it's going to ask you to essentially pay, and this is where you can add a coupon code. So for anybody who attended our 2019 BBFOK Summit and were one of the first 10 hospitals to register, attend, and evaluate, then they were awarded seats worth $240 worth of seats for this online training. So this is where your staff will put in the coupon code for your stipend. And so for those of you who got 8 spots, then that code can be used 8 times here by the different staff members as they sign on. And this will also apply if you are part of the BBFOK program. Once we're in a little bit of a gap right now because our IT person had a family emergency, which has pulled her away for a number of days. And so we expect her back in about mid-May, and then I can have this discount code for all of you who are part of our BBFOK program. So if what I'm saying doesn't make sense, I should clarify that this training is normally $60, and being a part of the BBFOK program, one of the perks is that we give you that for half off. So BBFOK participants only have to pay $30. So we'll be distributing a code for all of you who are a part of BBFOK. If you are not a part of BBFOK and you would like to be, then please feel free to write us. It's a pretty simple little way to sign up just to get some good discounts and to make sure that you're up to date on everything going on that's really necessary for birthing hospitals, for baby friendly, and breastfeeding in general in Oklahoma. If you do a multi-seat purchase, then through Digital Chalk, then you will also get a code. It'll be automatically generated, and this is where you will apply the code. So after you register, let me see, I'll go back. So you click the register button, it'll send you to this page. If you have a code, you plug it in, click apply, so that way your price, you'll see it'll change, and then you go to checkout. Not incredibly different from Desire to Learn, Digital Chalk also requires that everyone has, when we say register, you're creating an account. So even if you are the purchaser, like say you're the education coordinator for your facility, you're still going to create an account just so that way you can pay. That does, for your staff. It doesn't mean you're paying for you.
Registering for yourself.
Yeah, you're just registering for your staff. So so everyone will create an account, and this is also necessary because this is a self-paced training. So you create an account, you work on it a little bit, complete 2 or 3 modules, sign out, come back the next day. Since there are 15 modules, I don't know very many people who knock that out all in one day. So the account allows you to go back and forth, or in and out, as we say. So if as I mentioned, if you are purchasing, then the next page that you will see will be for payment. And my name, you'll see, is in there already. And that's because whenever I was creating these screenshots, I went ahead and on this last page, I entered in my name. So it automatically plugged it into here. So there's some things where it's trying to help you. But so this is how I know that whenever you sign up, if you did not enter in a coupon code, you will see this page to pay. If you did enter in a coupon code that is like for a free session, or if you bought multi-seats and your staff member is entering in a coupon code for something you've already paid, they will never see this page. The pages that they might see will be just some demographic data, and as you can see, there's 4 things that are highlighted there that are really the most important, and that College of Nursing, who is helping us with this program, this is the information that they would like to know. We've created an account. This is your dashboard. And dashboard is just where all of your courses are housed. And you'll see down here we've got 2, there's quite a few different ways to do what you need to do. It's pretty user friendly. So you can click, whenever you are registering, this is our course. And you can simply click here on the play button, or on this little percentage, which is telling you your progress throughout for this course. You can click on either of those to be able to launch the course. quick little plug. Up here is a catalog tab, and College of Nursing has various things that might be available to you. You would still have to purchase them, but if you're looking to get some more education, you're always welcome to look at that tab. Also on this dashboard page, you'll see a receipt option. So for those of you who need to purchase the training on your own and then be reimbursed by your facility, this is another way. This is always here. So if you got the email or did not get an email, lose your receipt of any kind, it will always be here. The other thing to notice here is this little calendar. The calendar is there because the biggest change for us, apart from switching learning platforms, is that we are now initiating a 90-day time limit to completing your course. So from the day that you start, that you push play on this course,
the clock starts ticking.
The clock starts ticking. If I'm incorrect on that in any way, I will send out a mass thing, because my only other thought would be from the point of registration it would start, but it so I will have to get confirmation on that.
But generally 90 days.
Yeah. But yes, but 90 days for sure. So once you, where'd it go? Okay, so once you click the play or the little percentage, you'll move to this page, which gives you a pretty lengthy description of exactly what we've created here. And you can see once again here at the pink arrow where you can see how far you've gotten in the course, because each time you're launching, you're not starting it over, you're just continuing where you were. So you can see where you've completed and how much longer you have to go to complete your 90 days. And then of course the great little start course button. So whenever you get into the course itself, it'll look like this, where everything is just in a column. And you'll see at the top the maroon colored pre-test. And you'll notice under that, everything is grayed out. So this is, as I mentioned before, it's self-paced. But it is also, it also has requirements that you have to do there are 15 modules. Each module has items within it, and you have to do them in order. And you have to complete the quiz for each module to move to the next. So you'll see here, and it's a little faded out, but everyone takes the pretest, then you'll have your first module where you start. There's 2 videos, then the quiz. I believe there's a PowerPoint actually. So PowerPoint, video, quiz. And then you can move to module 2. So you know which ones you can click because they will be in maroon as opposed to gray. Your quizzes will, you shouldn't need to, like you did before, you should not need to have to email us to ask us to reinstate you. We have taken that away to try to make it a bit more, Becky got really excited, to make it easier for you. So all of that being said, I know this is a PowerPoint faux pas, but these are our 15 modules and the outline or the objectives for each one. And back in 2016, before Becky even knew who I was, maybe before she knew who Petra was, they created this lovely training, and it is incredibly detailed. And not only do we think it's great, Baby Friendly thinks it's great. So Baby Friendly has their objectives and the content they're specifically wanting to see. And then this is just a few samples of our page that we got back where they approved everything that we have on here.
Well, it's where we've mapped where all the content is, and Baby Friendly, that's a requirement they'll ask during an assessment is, okay, prove to me that your training, whatever you used, has met the 15 objectives and all the competencies under each one of those. That's mapped out so we can say exactly where in this training this particular bullet point was addressed. So there's actually several pages to this, and Sarah's just showing you 2 or 3 of them.
Yeah, just the 3.
So it's all mapped out.
So mapped out so that way we know that we're giving you what Baby Friendly wants you to see.
Yeah, no, it's later.
So that was a lot that we just went over. And so I have two summaries of what we just discussed regarding the online training. This initial summary is for your first time of getting onto Digital Chalk and registering. And so we'll have your registration link, you register, click in your code, check out, and the prompts where they ask you the demographics. You'll complete those. If you need to purchase, you enter your purchasing information, then you're to the dashboard where you can start our course. I just want to make sure everybody, because it's brand new, 90 days. Once your staff member starts, they've got 90 days to complete. Another little thing is, this is, as I said, it's the same that we currently have in D2L, just moved to a new platform. And just like with D2L, they will get a certificate at the end, which then your staff can download and send to you. It is something that I really want to stress, that if whenever you send your staff their information, for them to know that it's not being automatically sent to you, that they need to send you their certificate so you know that they've completed it. So that's our first time of using Digital Chalk. Once you've done registration once, then this would be the only summary that applies to you. So this is how you return to Digital Chalk to stop and start the course, or in the instance of a coordinator or a manager, for you to go on and pay for more seats. So the same thing, except this time you would click in the login link, you automatically go to the dashboard, start the course, get your ship.
So if they were going back in to maybe enroll more staff, there's a place on the dashboard where they do that. They register more people or something.
Yes, there will be. It would actually, the course. Let me go back. Where I did the plug catalog.
Okay.
This is where you can do it. Good point, Becky. Yes. So we are in the catalog, and still under our title is BFHI Training for Hospital Staff by OBRC. Okay, if you get motion sickness, close your eyes because I'm going to go fast. All right. So now that we've mentioned our new platform for Digital Chalk, a quick little mention is that in 2020 we are hoping to have a brand new curriculum that will be online on Digital Chalk. So as I said, right now, what your staff have seen in D2L, they will see in Digital Chalk. But by 2020, we hope to have a brand new curriculum. We are working with OU Norman's educational department and have a great grad student that's doing some work with us, and we're really excited to see this happen. So we've talked about online training, and now just a quick little recap of our two in-person trainings that we offer. So that, again, is our MBME training and our BBB trainings. Again, just like with the online training, links to register and information about our in-person classes are always on our website at the Events and Training tab. And you'll see right here under in-person classes, and we'll have MBME, so Breastfeeding Basics, Making Breastfeeding Easier. That's what we call MBE. And then Breastfeeding Basics and Beyond, our BBB. And we'll learn a bit more about this. One little note, though, is in offering these, we do have sometimes where we don't have enough people registered, and we do have to cancel. So that is our only little disclaimer for these classes. So MBME, MBE. There's a lot of acronyms going on today. This is our one-day class for 7.5 CNEs. This class is offered free of charge to you because the Oklahoma State Department of Health provides us with a Title V grant to be able to provide everything that you need in order to help breastfeeding statewide, try to get those rates to go up and to be able to educate the staff. And just anyone, any healthcare professionals who work with breastfeeding, we welcome them all to this. Our main goal with them is to provide all of our, all the evidence-based breastfeeding education. And Becky works hard. She updates those PowerPoints before every training. And
Much to your chagrin.
I said that a little harshly. She's making sure everything's up to date. She's got it down. She's doing good. So to get a little bit more into the one-day class, I have the agenda here. So basically the class is from 8 to 4:30 with a couple of breaks and a lunch. Our objectives are, as you see listed there, it's all breastfeeding related, and just to help your staff be able to leave that day feeling a bit more confident in their skills and in their knowledge, knowing that their knowledge is up to date. And even to add to this, this training helps to meet the baby-friendly requirements for clinical skills training. So for these MBEs, I'm going to pause on that every time now. We schedule four MBEs every quarter, and we schedule those here on our OUHSC campus in the SAMUS Education Center. In addition to what we schedule, you can schedule us on demand, or I say us, you can schedule Becky on demand to come to your facility. I know we're going to St. Anthony this July and August, I believe. So for the 4 classes that are scheduled quarterly, registration is online through our website that I had showed you earlier. And then below here, we just added we evaluate all of our trainings. It's very important to us that we're doing a good job and that people are absorbing the information that we're presenting to them. So the comments that we tend to get a lot are that people love the videos and how interactive it is. And even people who are not new to breastfeeding, they say it's a great refresher for them, and that they still enjoy coming in and knowing that they still got it. So moving to our next and last in-person training is our Breastfeeding Basics and Beyond, or our BBB. It's a 2-day class, and you get 11.8 CNEs. Here I have a picture of the agenda. So on 2 days, the first day starts at 9, ends at 4:30, but on day 2, we start at 8:30 and end at 4, just trying to make your first day start a little later and your second day end a little earlier.
And that allows for people that are traveling in from out of town, so a later start and an earlier finish. So allows people that may have a bit of a drive during the training.
And again, this training, just like the MBEs, are available through the Title V grant from the State Department of Health, and meet the baby-friendly requirements for clinical skills. One thing oh yes, here it is.
Go back to that for just a second. And this training includes all of the content that's covered in the Making Breastfeeding Easier, with additional information to help for the State Health Department. It particularly helps them train all their home visiting staff. But the training is open and appropriate for anyone that's working in maternal child health.
So for the main difference between these 2 classes, besides 1 day and 2 day, is also the BBB is the only one that is automatically scheduled in Tulsa as well. So we'll do with each, we do 4 BBBs a year, and it's usually two in the spring and 2 in the fall. And of those 2, 1 in OKC, 1 in Tulsa. So we go to Tulsa twice a year, and here at the SAMUS Education Center twice a year. Again, registration is through our website, and you can still request Becky on demand if you would like. And then just a few others of the testimonies here, and one that I really like is clarification on breastfeeding myths, and then of course the up-to-date resources, which Becky really prides herself on, and we are proud of her for it. And so my references, since this is more of a how-to, is just simply I did use the baby-friendly guidelines, and those are available online. I'm sure you guys already have a copy. So, any questions at all? Becky, Petra, questions?
It's really hard to see how they're.
I think everybody's ready.
I have a question.
Oh, yeah. Can you, is that
So for the education this new education, will we, as the lactation consultants that are issuing or providing the names, will we be able to look and see what they have left to do, or is that still up to you guys?
Well, each staff member should be able to tell you, but I know it because we were doing our check-ins there for a while. But
that's a question we'll have to ask.
Yeah, I'll have to ask. Yeah, I'll ask College of Nursing about that. Actually,
The reason why I'm asking is it would save us from having to call you guys or email you guys and save you some
Right,
time.
right. So they want to be able to monitor their staff's progress. So that's the question we can ask.
Okay, so we'll ask nursing what our options are for you to be able to monitor staff.
Okay, and I have another question.
Mm-hmm.
The doctor's education, my doctors are having some difficulty getting their certificates. Like they're having to redo the evaluation 3 or 4 times before they get the certificates. And I've actually had one of them come and sit in my office and do the whole thing like 3 or 4 times before he was finally granted a certificate, and did the same thing over and over and finally got it. And I don't know what he did different. I have called the company, I've emailed the company, they've not responded to my phone calls. Are my doctors the only ones that are having issues, or is it other doctors too?
Is that Charlie?
Yes.
Yeah, and is that which online training is it that you're
volunteering?
The 3-hour online training.
Have a 27%
going back.
chance of gaining employment. And
We're getting some background noise too. Are they doing the University of Albany or the community health training?
Community health training.
Okay, I think we've heard that. We've heard that from some of the physicians here at OU as well.
All about time.
Okay, I just
So we can try to reach out to them and see, what's going on there. Because we don't have an answer for that.
A quick $50 heart scan by our advanced imaging
It's home music.
in your arteries.
Okay.
That's a clear picture of your heart's health.
So other questions?
No fasting and no physician.
I know I had one other
your $50 heart scan
announcement we can make is that our final webinar
918-787-3750.
Our final webinar of the year, and we'll be sending a calendar invite out there. So is actually, we usually try to hold these on the second Wednesday. It's actually getting booted back a week, so it'll be on Wednesday, June. So just note that slight change, and that will be the final webinar in the series of the evidence behind the 10 steps. So I'll be covering the evidence for steps 9 and 10. That webinar, but more on that when you see the calendar invite.
Until 5 p.m. and Saturday from 8 until 4. Located at 13th and Main Street in Grove. For more information, call 918-786.
Happy that you guys are there.
Yeah.
Any other
There
questions?
was a way to mute all. Can you mute all?
There we go.
Take care of yourself.
There we go.
That helps.
There we go. Okay.
Well, if we mute it all, we can't
So if
hear
they have
questions
it,
now.
well, if they have a question,
Type it in the
type
box.
in the chat
Well, no, they
box,
can unmute themselves. It's a,
but not if you muted them.
Really?
Yeah, if you muted them all.
Oh.
Which we can unmute if somebody, type in the chat box if anybody has another question. So, do unmute all.
Visit IntegrGrove.com for a list of Integra's providers. Now, go take care of yourself.
Oh, okay.
yeah.
Yeah. Okay.
Okay.
Yeah, they can. Yeah.
Okay, sorry, we're still learning. Okay, so let's ask that again. If you have any other questions, because of that hold music, we've muted everyone. But if you have any other questions, you can unmute yourself and ask away.
It's all quiet out there.
Yeah.
Okay, all right, good.
And also I would just add, if anybody has any particular announcements or news they want to share, we're always happy to
Share.
share good news. So we'll have lots of updates coming in the next couple of months, especially with all the changes in the works on our hotline and the texting capability, which Petra's been working really hard on, Petra Action and Jacqueline. So we're very excited about that. And we'll, have hopefully, information, more specific details on that by July when that's getting launched. So,
Okay, well, if nothing else, then I guess we're done.
Yeah, stay tuned. We'll be on the lookout for a calendar invite on the final webinar of the year. And if anyone is representing a hospital today that's not currently enrolled in our Becoming Baby Friendly in Oklahoma project, definitely email us. We're here to help, and I'm always happy to come, for a meeting with your leadership. Just had a phone call with somebody recently about, misconceptions and, concerns they have about baby friendly, so we can help kind of set the record straight, if you will.
Also, I'd forgotten to ask you, I know sometimes that you guys will gather around one computer and sign in with one person. So if you could either let us know who all is with you if you are in a group in the chat box, or send us an email. And we like to report on that with all of our to our reports to the state. And so we always want to know who's all out there. And again, just really appreciate you taking your time to come be with us today and listen in. And if you have any further questions, feel free to email us, and then I will look in on community health training issues, if staff can monitor the progress of, if you can monitor the progress of your staff, and then does the start of your 90 days start at registration or at pushing play on the training itself. So look out for an update of that when we send out the links. Hopefully I'll be able to plug it in at that time. If not, I'll still send it out in a separate email.
So, right. I think we'll call this a wrap. Thanks so much to Sarah for putting this together and presenting for us today. And we will be in touch. Enjoy the rest of your week.
Thank you.